Good afternoon, dear students. Today we will start the another new topic. It is word round participation. So, as we know, the word ward and round participation. Ward means it will be any part or any area or any compartment of the hospitals where the patients are relocates, and we are involved into the participation into the rounds we are visiting towards that wards where the patients are taking the medications, patients are taking the treatments. So ward rounds are generally taken by the physician, pharmacist, nursing staff, etc. Ward rounds are the routine clinical rounds. Means whenever any patients are under the trial or under the treatments, so it is a routine trial where the healthcare providers visit patients in the ward to assess the progress of the patient's condition of, of the inpatients. Now, whenever the patient has been admitted into the hospitals for the first time, what was the first condition? What was the various symptoms he was suffering from? And if there any progress occurs, that we can analyze, we can check by taking these rounds, routine rounds. We are doing rounds at least once in a day or twice in a day. In that we are checking their body temperature, we are checking the blood pressure, their condition, their status, health status in case of any post-operative or in case of any accidents or in case of any treatments in which any difficult or any critical drugs which we are giving. So in that we are checking their status, their health status, whether their condition has been recorded or not, or how much relief the patient has got, that we are checking here. Doctors led ward rounds comprise of unit of medicine or any other specialty where in professors, in case of any medical, means in case of any educational institutes which is having accompanied with hospitals, especially in case of MBBS or BMS. So it is accompanied with the hospitals. So in that, the professors who are maybe from the pharmacy field or maybe from the medical field. So the professors are also involved into the round professors, associate professors, assistant professors, senior residents, postgraduate students, and interns along with the pharmacist. Means these all are the faculties, it may be from the pharmacy field or medical field, and postgraduate students may be from pharmacy field or the medical field. For example, the students who are doing MD or MS, and in case of pharmacy they are doing M-Pharm, and the interns means the students who are undergraduate students who are doing their MBBS or BMS or BHMS, or the B-Pharm students, along with the pharmacist and nursing staff, which observe the patient's conditions. They are routinely observe the patient's conditions. They are take down the notes regarding the patient's status. It may be their body temperature, their body weight, their blood pressure, their respiratory rate, their oxygen conditions. So they are taking all the notes, they write it down in form of notes and assess to decide further therapeutic for the patients. And they will assess the patient's conditions. Now, what is the actual condition of current status? Whether they are seeking any medication, further medication or not, or they should go with the same medication, or we should change the medication. In that, they will discuss among themselves. Means the physicians, pharmacists, nursing staffs, they will discuss among themselves regarding the current conditions. Now we will discuss the goals of the ward round participations. What are the goals of these ward round participations? The goals of ward round is to closely monitor, means we should check the patients very closely. Sometimes what happens, if you won't see patients closely, you won't monitor closely, we will miss something. We will miss some sort of indications, or any sort of adverse events, or any type of complications which can be missed by us, and it can induce, or it will produce another large complications which may become life threatening. That's why we must have the close watch on the patients regarding their small peculiar things also. So closely monitor the patient's conditions and take immediate interventions. Immediate interventions means immediate we should indulge, immediate we should enter into their conditions. We should start our program, or we should start to take action immediately. It is called immediate intervention to improve the patient's conditions and avoid death. So immediate interventions means we should immediately take the actions in the way to keep patients' condition in good healthy conditions, to make them healthy, to come out the patients from the critical conditions, or from the disease conditions, from the any conditions where the patients are not feeling good. So that type of work we should do here. So by which we can improve conditions. Suppose patient is not having ability to take oxygen, he is having difficulty, dyspnea-like condition will develop. So in that we can give the oxygenation by giving oxygen cylinder. We can give them ventilations. We can change the air through their nostrils, through their air passage, and we can instill that oxygen into their air passage. Or we can give them proper humid conditions by using AC, or we can maintain the temperature, or we can immediately work on their stomach, or we can work on their kidneys. If accumulation of the bladder is there, in that we can remove that excess amount of urine from their bladder. Like that, any sort of critical condition which can decrease or increase blood pressure, or we can worsen the conditions of the patients, that we can do here immediately. Sometimes patients are required uh, drip, if they required dextrose, or they required the glucose. So in that we can, in the form of drip we will give them, or if they require normal saline, so according to their conditions of electrolytes, their body requirements, we can also give them blood in if they require. So accordingly, whatever their body requirement is there, accordingly we should give them. Sometimes in case of pain, we should give them the drug like diclofenac, which relieve their pain, or we should give them antibiotic in case of any infections. So accordingly, by considering their parameters, body conditions, physiological conditions, we can take the decision according to their status, and we can avoid their death. Our primary goal is to avoid their death, keep the patient in good healthy conditions. The doctors are visiting all the patients admitted in their unit in an order beginning from intensive care unit to the general care. So we should, the doctors and these pharmacists are starting their uh, the ward visiting starting from the ICU, intensive care ICU, and they will, after that they will go for the general ward, so that they will get the information of the conditions, how they are living, how they are showing their response to the treatment or not. Here also there is documented case reports to remind the case history of the patients, who quickly updates and is able to change the strategies of treatments. And they are also being document that how the treatment is working, how they are following or not. So they will write in documented form so that it will remind for the next time if the same condition will occur. And it will be the data, it will be the case history. If you are writing in the routine work that by giving this drug after 24 hours we got 100% results, means it is a data, and it becomes the case history, and it will give a good results. If it is good result is there, so it will good data to proceed our work in the future process, future conditions. Objectives of the ward round participation. So this is the basic objective of our ward round participation. The ward team comprises the doctors, physicians, nurses, and pharmacists who work in a team with a common objective to ensure safety of the patient is our primary goal. Safety, effectiveness, because the patient is suffering from any critical issue or any life-threatening disease. So in that, our treatment should be effective so that patient must come out from that condition as early as possible. So effective, whatever treatment you are giving, it must be precise and it must effective. It must bring out the patients from that critical condition as early as possible, as fast as he can, and economic as well, because all the patients are not that much well enough to give your bill, to pay your bill. So economic, any poor can bear any So economic, patient friendly treatment means patient should freely take that treatment. There should not be any complication or any nuisance experience or any confusion or any fear should not be developed into the patient's mind when he is receiving any treatments. So it must be patient friendly treatment with knowledge inputs, means the pharmacist must give knowledge into the patients during its treatments. Why we are giving these treatments? What is the advantage of the treatment? And after receiving the treatments, how much time the patient will get and how patient will recover from that treatment? And it should be communicated to the patients, and we should convince the patients so that at 100% the patient will be get relief or he will recover from that typical sort of critical conditions. So knowledge inputs, if your knowledge, you must give that knowledge to the patients of each professional practice. And after doing this practice, we are also getting some knowledge from the last patient's history, from so many patients if you are treated. So from that also, from the patients also, we are getting the knowledge, we are getting the experience, and we are using that knowledge for the next patients. Now here we are discussing the role of pharmacist in ward round participations. The pharmacist, being an expert in the matters of drug, should be available for the ward round team to decide upon the matters of dosage regimen. Pharmacist must be included into the ward visiting because pharmacist is having the knowledge of dosage regimen, its dosage form, the drug which under trial, their formula, the nucleus of the drug, the uh, viscosity of the drug, the color of the drug, the acid, each and every aspects of the drug, the pharmacist is knowing its miscibility, immiscibility, at which pH it will be uh, it will be stable or unstable, either it will affect on the humidity or not. So all the things regarding the degradation, regarding the doses, regarding their peak plasma level or the half life of the drug, all these things, side effects, adverse effects, toxic effects, is doses of adult, doses of the kids, in health status, any critical health status, what drug, whether that drug is safe or not. So its safety, efficacy, all these things, the pharmacy is knowing each and every shade, each and every aspects of the drug. So pharmacist must be included into the ward round. And formulary interpretation means whatever formulary we are maintaining, in that we are doing its interpretation, we are maintaining the drug according to the requirement of the patients, the drug which are required for this treatment, the treatment which are more commonly going on, in that most common drugs we are try to maintain into our formulary, into our dispensary, and accordingly we are making the list of that required drugs. So here the formulary interpretation also done by our pharmacist. And ADR monitoring, it is very important important department. It is pharmacovigilance departments. Their main goal is to do the ADR monitoring, adverse drug reactions monitoring. Any adverse drug reactions which occurs due to the drug or drug food or drug environment, any sort of drug drug interactions or adverse drug reactions which are occurring. It may be skin rash, it may be fever, it may be any anaphylactic shocks, it may be any severe paralysis or any sort of adverse drug reaction which is occurring to the patients. It can be monitored. And drug-drug interactions, as recently we have discussed, lots of drugs if you are giving, in case of polypharmacy, there are 100 chances, 100% chances to develop the drug-drug interactions, because not all the drugs are compatible with each other. Either one drug will alter the effect of another drug, so it will become the adverse drug reactions or drug-drug interactions. And drug food interactions, because the only pharmacists are knowing regarding the effect of drug on our fruit or on our food, which sort of food we should go with that drug, whether that drug will affect the effect of that food, or food will alter the absorption or distribution or the metabolism of that typical drug. The pharmacists are knowing all these things. So that's why the pharmacist must include into the ward round. And drug and poison information services, and also pharmacist knowing regarding the which drug is poison if you will take in that dose. So drug and poison information services also the pharmacist must include. They are having the great role into them. The availability of the pharmaceutical services definitely enhance accuracy of treatment and patient safety and efficacy. It's true. Pharmacies are having all the information regarding the disease as well as the drug. So if we will include pharmacist into our round participation, definitely he will increase the accuracy of treatment and patient safety and efficacy. Now here are the duties of pharmacists in the ward round that we should discuss one by one very fastly. The pharmacist in ward round should take at least twice, two times, one with the doctors and another one with himself alone. Means in the morning is with the doctor he will go, and another round he will take in the evening or in the afternoon session. He will go alone to check out the effect of drug into the patients. In the first round, he follows the treatment given and check the formulary for the dose prescribed. So he will check the formulary for the drug prescribed, whatever drugs have been prescribed by the doctors, whether they are available into the formulary or not. If not available, he will try to maintain that formulary, try to maintain that list of the drugs. Further, he may also critically think any possible risk to the patients due to the drug administration, and he will alert the team, because pharmacists are knowing regarding the side effects and adverse effect of the drug. So he will discuss or he will critically think before giving any drug. The pharmacist will critically think regarding the possible effects of that drug, and if any any indication is there or if any warning is there, so he can alert to the team, he will alert to the physician that this drug may induce, any example I'm putting here, that this drug may induce the blood into the nose, or this drug may increase the chances of hemorrhage, or this drug may increase chances of hypertension, or it will induce the paralysis or medullary paralysis, like, or it will produce the disc congestion. Now, in case of pandemic condition, especially, disc congestion is very very worst thing. Person can die if he can't able to take breath. So, like that, he can administer, or he can alert regarding that administered drug, that this drug may have this effect on your this system. So he can alert and prevent the further causality that would have occurred, because he will check out what was the causes of that causality which has occurred in previously, by checking their effect, that this drug is producing that typical effect, that this drug is producing decrease into the platelet count, and platelet count are also affecting, they are having great role into the bleeding diseases, like like ulcerative colitis or IBD. So in that it is very or in case of hemorrhage or internal bleeding or liver damage is there, or ulcer is there to your stomach, or to your peptic ulcer is there. So in that, for avoiding internal bleeding, we must ensure that which drug is responsible for that, and due to which that person have died. In lots of movie also, we are visualizing what is the slow poison, and it is not the poison, but that drug may affect on your typical cell lines, and due to which person may die. In lots of movies it has been shown. So here, so only pharmacists know that what is the typical factor which is responsible for death, and by keeping that thing into your mind, he can avoid the next death, he can avoid. And the further causality of that would have occurred due to the non-viability of the clinical pharmacy services. And if there is not smart pharmacist available, only the physicians are available, so it can leads into the death of that patients. So the smart clinical team must have the pharmacy services. In the second round, the pharmacist target the patients prior to discharge and advise the patients regarding discharge medications. Because once you discharge, after that also the relapse may occur. Patient's condition again will become worse if you won't continue the such medications which they should follow after the guidance of pharmacists. So discharge medication also very important. So in that second round, he will discuss that drugs with that patients, and he will convince him to take that medication once he discharges. He also motivates to knowledge diet, because pharmacy also having the knowledge of the diet, what food contains what things, which contains fats, which contains carbohydrates, minerals, what he should avoid, what he should take. Now, for example, in case of diabetic patients, he can tell to the patients, he can consult with the patient that he should not take any diet which contains sugar. Also, he should not take the fruits which contains more sugar, like mango, or like banana, or like that example. And also he can tell, or he can warn to the patients that in which condition you should not allow, in case of the bleeding problem, bleeding disease. Now, for example, internal bleeding, or in case of IBD, like bleeding disease, what food he should not take. The food which contains gluten, or food which contains wheat, which contains the dairy products, milk products, we should avoid. So, like that, he can give the information. Now, especially in case of hypertensive patients, he can give suggestion that you should take, or you should try to decrease the level of salt intake, NaCl intake, which can increase your blood pressure. So, like that, he can give the information, suggestion. You can give the suggestion to the patients regarding that, and also exercise. and we should go for the yoga or pranayama or go for the morning walk, which is essential for your maintenance of your health status. So in this fashion he can also change the daily habits of the patients, which will also give an impact for well-being of that patient, which will also give a concrete decisions regarding health, exercise, and medication. So this require for the disease management of the patients to be discharged. Now here are the importance of the ward round participation. Now here we will discuss what are the various important things of our ward round participations. The withdrawal of pharmacists from the ward rounds will be a great loss for the clinical team and the patients, because as I discussed earlier, pharmacists are knowing regarding the drugs, their each and every aspects of drugs, foods, drug effects, pharmacodynamic, kinetic. How can we lose pharmacist in the round participation? Because if we lose him, no, because not all the drugs are managed by the physicians, because pharmacists are well in touch with the drugs informations regarding their adverse drug reactions, drug interaction, drug food interaction, drug endometry interactions. So all these informations are pharmacists are knowing with that. So he must take pharmacist in his each round. The medication errors, incorrect doses, because sometimes the doses if they are given incorrectly they will also worse the conditions. And medication errors, which drug should taken at morning, we should take at night, which we should avoid in the evening session, with which two drugs we should not take concurrently. That information can be given by only pharmacists. That's why for avoiding the medication errors or incorrect dosage forms, at which drug we should take at proper that dose, that only known by the pharmacist, and can we bring down the therapeutic outcomes in the negative perspective. Because whatever therapeutic outcomes means whatever results we are expecting from our treatment, from our management, if we will avoid pharmacist in our own participation, so we won't get the possible results, we won't get the possible treatment outcomes which we are expecting from the patients. It will well establish that the expectations from the patients does not stop at the clinical care, but for a cost effective economic expenses with improved quality of life. So the expectations from the pharmacists will not stop up to the point that clinical care means only the patients will completely cured from that disease or that condition or that any critical issue, but also we must be think regarding the cost effective economic expenses, because whatever the drugs or expenses the patients are bearing, they must also get that facility at lower cost, at minimum cost they must get the effective concentration or effective therapy for which they are they are liable, they are expecting from the pharmacist. So pharmacist is only knowing that what is the minimum effective drug out of all the brands, which brand is having low cost, which brand is having high cost, what are the molecules are having same molecules, same formula, but having different company, different trade name, brand name. Some are generic, some are were getting at the Jan Aushadhi medicals. Only pharmacists are knowing them. So according to the patients, they can bring down the cost of the therapy by considering all these things. So it is the only role of pharmacist. Doctors are not there to decrease the bill of the patients, but pharmacists can bring down their level, bring down their bill by decreasing the high cost by replacing high cost drug by the low cost drug, which are having same efficacy. Only pharmacists can do that. So that miracle can be done by only pharmacists, and by this way they can improve their life, because by they are decreasing their economic expenses And also pharmacists can touch in the patients. They can give them information, suggestion, advice that what should avoid that in future no relapse, no recurrence of that typical again disease will again occur. He can knowledge, he can educate the patient also by doing these things so that the economic loss will not occur in future. The gaps in the knowledge of healthcare practice in disease management can be fulfilled by the qualified pharmacist in the hospital. Because if you are equipped with the good knowledgeable healthcare persons, especially pharmacists, so they can acknowledge the patients, they can educate the patients, teach them that how you have to survive into the general life. Now in the pandemic condition, mostly the people don't know what they should follow, what they should not follow, and how much they have to rely on the doctors, because nowadays lots of malpractice is also going on. So the better way, prevention. So how can we prevent the number of diseases? That only pharmacists can tell them that by doing this thing we can prevent our disease and we can live a healthy life. If you will live a healthy life, not a single disease will touch to your body. You will, if you are healthy, if you are if you are living a good life, good healthy life, no any infection will touch you. So that's the role of pharmacist, because by having that knowledge, he will fill all the gaps, he will fill all the misunderstanding or any misinterpretation which has been occurred into the general public or that community. So he can bring down their that all the misbelief and all the superstitions which has been occur into them, and they will bring up the good knowledgeable things regarding their health into the peoples. So in this fashion, the good pharmacist can uh, bring up the standard of health into the peoples. So students, in this fashion, today we have discussed the importance of around participation of the pharmacist. So goodbye for today. If any queries you have, you can discuss with me afterwards. So have a nice day and bye for today.